So there's many ways that acupuncture and Chinese medicine can help pregnant ladies in their second trimester. So one of the common things that we're seeing with many, many women is low back pain, pelvic pain. This is common during any pregnancy and almost normal to expect. So it's really nice to be able to have the acupuncture, moxibustion that we can do. And then oftentimes we will teach them how to do the moxa at home. So that's something they can take with them and help support themselves on their own or with their partner at home too. So some of the other things I see midway through pregnancy, and I see a lot of this actually, is placenta previa. So that means the placenta is covering the exit and the baby cannot come out vaginally. So that's an automatic C-section. So for a lot of women, this is very, very concerning, very nerve-wracking. So it usually gets diagnosed around 18, 20 weeks, something like that. And then they usually have about a month before they would see their provider again. And as an acupuncturist, you really want to get that placenta, shifted within that time. And usually it's usually not a problem. So for most women, it's related to a spleen malfunction, and that's a Chinese medical terminology using, so that there's something wrong with the way people are absorbing nutrients into their bodies. So oftentimes we can talk about things like digestive enzymes adding into their diet and other things they might not have thought of, in addition to getting acupuncture to support their spleen and stomach. Some of the other things we see a lot of is anxiety. It's a very stressful time to be pregnant, and our bodies are going through changes, our minds are going through changes. So there's just a lot going on. So acupuncture during pregnancy, second trimester, definitely helps turn down the volume of that stress. And then we can also start to talk about the birth, which is always forefront on every pregnant woman's mind. So knowing that we are going to talk about it, you're going to get educated about it and become empowered, makes it less daunting when you kind of face any of the concerns you have head on. Some of the other conditions I might see is if someone's having high blood pressure or has been diagnosed with gestational diabetes, I'm often able to utilize acupuncture, Chinese medicine to help stabilize or reduce those so that it's not quite as intense. And keeping the people out of gestational diabetes helps them to stay low risk. So for example, at one of our local hospitals, pregnant ladies have the opportunity to choose to be with the midwives and under midwifery care, or to be with the OBGYNs. So if a woman is a normal, healthy woman having a normal, healthy baby, she gets placed with the midwives, then she develops gestational diabetes. She's going to actually have to transfer out to the OBs and do a high-risk delivery instead of a natural birth in the birth center. So a lot of times that will really scare them a little bit, enough to change their diet, to go for walks at night, things like that they can actually control to help keep that diabetic state under control. Sometimes women aren't sleeping well in pregnancy, and that's another really common condition, and it can relate back to the anxiety a little bit, but it's also they're uncomfortable. So insomnia is another factor that we could treat during pregnancy and really any time during a woman's life.